Great, great. Thank you. Thank you, everybody, for being patient for a second. So, Manny, let's jump into some of these questions. I know that you've worked quite a bit in the cannabis industry and have a lot of experience at this, and have worked with many patients on consulting them. In fact, your operation, the Blunt Joint, does a lot of work to help people understand medical cannabis and what's best for them.
You're absolutely correct. Anything from the use to getting started, how to navigate not only the dispensaries, but also medical clinics and otherwise. So I'm happy to help.
Sure. So we have some question is, what are the pros and cons of tinctures, and can they be used in baking without destroying the benefits? That's a good question, Manny. I know that tinctures are very versatile. What's your thoughts?
They are absolutely versatile. They're one of my favorites because it really emulates starting slow, going slow. You can titrate up. Those are some of the big pros of it. Some of the cons are with all edibles or orals or sublinguals is that it may take a little while for it to take effect. But since tinctures are sublingual through the mucosis of the mouth, you get some rapid absorption. So you should start feeling an effect within 30 minutes or so, and then it can last upwards to 4 to 6 hours depending on the dose. So that's why it's very important to titrate up, start low, go slow, and find that sweet spot that we described in other webinars.
Sure. And you can use tinctures when you're making your edibles. Drop a little bit in the whatever you're making, the cookies or the candies or gummies.
You can. However, I always recommend, since the tincture is already a final product, and heating it up, whether baking, cooking on a stove top, or otherwise, can actually affect the significant benefits of that product. I always recommend just adding it to something already baked or cooked or a drink. You could drop it right in. Some are oil based, so you might want it a little warm, but some are also water soluble or encapsulated. Therefore, it will dilute with the substance and actually give you a homogenized or balanced effect.
Sure. And I think that's really important. I know that a lot of times some lingual drops can be used. I tend to use dry flour, or I tend to use the syringes when I'm doing the cooking with edibles. I think it makes it a little easier to use the products. But it is a very effective method of sublingual drops are a very effective method of using medical cannabis, and it's the way most people really start out by using medical cannabis. Let's jump to the next question, Manny, which is what works best for neuropathic pain? And I think the question of routes of administration is something that really is personalized to you. Some people don't like smoking, some people do. Some people are concerned about vape pens, about putting something into their lungs. Some people really just want to be able to take something like a gummy, which doesn't work right away, but does work after about 30 minutes to up to 2 hours. But I think what's best for neuropathic pain is something that has the appropriate terpenes in there. And I think those terpenes for neuropathic pain really are myrcene, beta-caryophyllene, and also linalool. Your thoughts, Manny?
Well, you kind of stole my thunder on the terpene list there, but you're absolutely correct as far as what I'm concerned with as well. But also, a great thing about neuropathic pain or neuropathy pain is that you don't only have to take something orally, sublingually, inhaling, or otherwise. You can also use a topical depending on the severity of the neuropathic pain. But you do want to use caution. Some topicals, like salves, are very thick, and rubbing it on can create more pain because it's neuropathic. However, there you can use tincture oils the same way you would use them sublingually. You put a couple of drops on your skin and you can rub that in. It's a little bit or a lot more fluid, and therefore it absorbs a little bit better or quicker. The only
Mhm.
difference is it won't penetrate as deep. However, you're also ingesting or taking another method. But those terpenes, beta caryophyllene, linalool, and myrcene are definitely the top three I would use for neuropathic pain.
Right. And again, the topicals will work for between 1 to 4 hours, probably about 2 hours. Where when you're taking the tincture drops, they'll last between 4 to 6 hours. And of course, capsules take maybe 30 minutes to 2 hours to work. And of course, they work for anywhere between 8 to 10 hours. So it just depends on your method of best method of consumption. And really what you're looking for is the terpenes. And those terpenes will then dictate and help you with neuropathic pain. And that pretty much goes for the same for fibromyalgia. I know that fibromyalgia and neuropathic pain affect a lot of the nervous system in your nerves in your body. One of the nice things about CBD is what they call a neuroprotectant. In other words, it coats the receptors and really helps them be able to recover and be able to address issues like both neuropathy and fibromyalgia. What do you think, Manny?
I agree. I was going to say the same thing. Fibromyalgia kind of falls in that same realm. But when I look at the questions and see what method works best, I also want to remind people to remember that Each person is different. Your symptoms, depending on the type of neuropathic or fibromyalgia, oh, excuse me, neuropathic pain or fibromyalgia, will dictate what method would be best. How severe it is, how light it is, what your goal is, whether you have to work while you're using the product, if you're retired, if you have to play with your grandchildren or children. All these things play a factor, and they should be asked for your benefit on what route would be particularly beneficial for your quality of life that you're seeking.
Sure, sure. The next question is a really good question, Manny, and I think it's one that's a lot of people ask, and that's what's the cleanest way to use THC without smoking? Clean ingredients, since gummies and chocolates have unhealthy ingredients. Really, I think when it gets down to the cleanest way to use THC, I think tinctures are the best way to go.
I'd agree. Tinctures, they're basically have a carrier oil, which is usually a MCT or multi-train triglyceride, coconut oil, palm oil, or such. And then it actually has the cannabis products unadulterated and tested per COAs or certificates of analysis. But this also begs the question on what you consider clean and ingredients in gummies and chocolates to be clean. Everybody has a semi-different relationship with that. And I would suggest that most, if not all, the products, even gummies, mints, chocolates, or otherwise, from a dispensary where you get a certificate of analysis, is pretty much going to be the best ingredients they can to put into that because they want the best product.
Right. I think there are a lot of these organic and vegan that it's important to point out. And if you're worried about the best way, a route of administration, and you're worried about the edibles, topicals work great as well. Topicals absorb right into your skin and work very effectively. You can get them both as regular topicals or transdermals.
Exactly. I was just going to say transdermals are even better if you want more of a significant impact because topicals typically won't break the water table and get into the bloodstream as much unless it's encapsulated, which there are products out there. And what that means is that they pretty much put it in an envelope that can get through that water table of the skin and into your bloodstream. So not only are you getting site relief at the site where you applied it, but you're also getting it within your system to provide more relief.
Sure. It's really good. That's really good. That's a good comment. Last pre-submitted question is a very good one. How will the passage of Amendment 3 affect the possession of cannabis? Will it increase or decrease the cost? Well, I think the first thing to point out is the wording on Amendment 3 only gives the lawmakers in Tallahassee the right or the option to create an adult program. We don't know what that adult program is. There is no text in the amendment that says that the actual adult program is going to have any particular characteristics. So we don't know what adult use is in Florida. That's up to the Tallahassee lawmakers. And as you know, many of the Tallahassee lawmakers are not in favor of medical cannabis and are in favor of doing things like putting THC caps on and things like that, which we kind of expect. Couple of key points here. Number one, do not give up your medical marijuana card. And that's because if it passes in November, there's a clause in the actual amendment itself that the rules have to be stated or put out by May 30th, at the end of May, beginning of June. Whether they do that or don't do that, there's no teeth in that particular statement. In other words, if they're late, they're late. If you don't have a medical marijuana card, you're not going to be able to get cannabis during that particular period. And I have to point out, there's a good chance because folks like Ron DeSantis and a lot of the politicians here in Florida have said that they're going to actually challenge this particular amendment if it passes. They're going to tie it up in litigation probably for a year to at least a year and a half, which means, again, if you don't have that medical marijuana card, you can't get cannabis to be able to help you with your particular condition. And more importantly, if you don't have that medical marijuana card, there are going to be provisions put into the adult use like taxes, could be taxed as high as 30%. I know in the state of Washington, it's 37%. You're going to be able to have access to stronger products or products that don't have a THC cap on it, meaning we'll probably get a cap of between 5 and 10% on adult use products, which we won't have a cap on, or we have a cap on medical cannabis products of about 30%. The point is you'll have to buy more product if you buy it through an adult use program, and you'll be taxed as much as 30%. So they cause you to require you to buy more and get taxed more. The break-even point for should I keep my medical marijuana card or not is about $75 a month. If you're spending between $50 to $75 a month on medical cannabis, it's better to keep your card and get the taxes free than being able to use adult use. And also remember, if you have a medical marijuana card, you can actually go out and talk to your doctor. He'll help you figure out which products, or at least which terpenes to use to address your particular condition. Your thoughts, Manny?
I think you pretty much covered it all. There's not much else left for me to say on that. I agree with all of it. I do certainly believe it will be taxed probably a little bit higher than 30. I'm thinking around 35, 36, like you said other states are doing. I do expect the THC caps to be in there. So as you suggested, Mark, you're going to be paying more for less rather than having your medical card to avoid all that.
Right. And this is something that's one of the scary parts about this adult use thing is we don't know what it equals. In other words, if we pass it, there's no provisions in that particular amendment that states exactly what the conditions or what the program looks like. And again, we're leaving it up to the Tallahassee politicians, which again, it makes me very uncomfortable. They're not the friendliest towards medical cannabis of people that we know. So that covers a lot of our pre-submitted questions. We had another question that came up. Deborah asked a great question. What is the best use if I have asthma? And I know you having asthma, you get concerned about being able to use or put vaping in your lungs. Although a lot of times, if forget cannabis for a second, there's a lot of inhalers that are used for things like like asthma. There are inhalers. There are some companies that have inhalers in the cannabis. In some of the dispensaries have inhalers. But I think what you really want to take a look at is using things like sublinguals and oral and also topicals to be able to address asthma. Your thoughts, Manny?
I completely agree. There is a caveat again, as you did in earlier in the presentation, Mark. I'm personally not a medical professional. I'm just a subject matter expert. But in my experiences in dealing with consumers, is that I've had a couple of asthma patients come up and have told me, without my recommendation, that they use inhalants and they don't use their inhalers normally anymore because it kind of acts as a bronchodilator. But it does depend on the product. It does depend on the terpenes, and that's a very tricky slope. So if you're going to do that, make sure you speak with your physician. You speak with the person that you're dealing with at the dispensary. Although at the dispensary, they're not medical professionals either, and they're not liable as medical professionals. So you really want to go with caution. But sublinguals, tinctures, gummies, and otherwise, sublinguals more beneficial because you get more of a rapid effect than you would like chocolates or otherwise.
Sure. And I do want to point out, cannabis is very effective to treat asthma. Among people, again, are worried about putting something into their lungs, and that makes complete sense. The terpenes are what you're really looking for. And I know in the case of asthma, you want to take a look at some of the terpenes like limonene and pinene, as well as beta caryophyllene. Those will help you quite a bit with asthma. Any other thoughts? Are there anything else about that we should think about, Manny?
No, I think you pretty much covered that one, Mark.
Yeah. I do want to point out, I know that there's not any more questions, and so we're kind of finished with that. By the way, if you do have any questions, please submit them. We'll be more than happy to answer them for you. But I do want to make some comments as we're wrapping up this particular webinar. Routes of administration are really personalized. A lot of people are concerned about putting something into their lungs, like the asthma patient, which is totally in line with their thoughts and feelings. That's where topicals, using things like tinctures, really help quite a bit. And I know that cannabis can be very effective. Don't shy away from it. And I think that, again, these are new routes of administration. This is kind of a new world using medical cannabis. And because of the 5,000 years of use of medical cannabis, there's a lot of different ways of using it. They've been using it for, again, whether it's from the American Indians, the Indian Indians, whether it's coming from Tibet, whether it's coming from Europe, whatever. There's a lot of different routes of administration that people have used effectively, and you can use that as well. Talk to your medical cannabis doctor. Talk to the dispensary. Again, are not doctors, but they do know the terpenes that you'll use, and those terpenes will actually trigger which cannabis products you should be using. Your thoughts on that, Manny? Your final thoughts?
Yeah, absolutely agree. Also, remember if you're going to dive into the rabbit holes of terpenes, that it's not necessarily going to be one terpene that you're looking for. It's a combination of terpenes. Even the distillates, as in the presentation, those terpenes are taken out, but they're reintroduced in a different way, naturally, of course. But it is going to be a combination of them, not just one singular terpene that you're looking
Sure. And I do want to thank everybody for joining us tonight. I know that with the hurricanes and all the different things that are out there, it makes it very difficult to not only join, but also sometimes get that internet connection. And I thank you very much for joining us.
for. Just wanted to say thank you, as always, Mark, for having me be a part of this. I hope we were able to reach some people and help them out. Sure, we did. And I hope to continue to do so. If you can always find us here on Medical Marijuana and Wellness Series or medicalmarijuanaaware.com. or excuse me, marijuanaorder.com. And you can find me at the Blunt Joint Diet Life. Thank you, and I wish everybody a blessed evening.
And I do want to finish this by mentioning, pay very attention. I know Amendment 3 has the panacea and the allure of adult use, and it's great, and I hope it does. Again, because it's not defined, I do know that there's going to be one thing that you're going to need. You're going to need that medical marijuana card now, and also when the program does get put in place, to be able to purchase medical cannabis products. And again, there's going to be a lot of different benefits to that. There is a video that is on our YouTube channel, Amendment 3 Explained. The bit.ly link is right here. Go to Marijuana Aware, and you'll be able to actually link or be able to find that particular video both on our website and also on YouTube. It'll really walk you through what Amendment 3 is, the pros and cons, and the reason why you probably want to keep your card, because again, just being able to access the product is really the key, and that's what you're going to need to be able to, even with adult use, to be able to move forward. I want to thank everybody for joining us. Manny, thank you very much for joining us. I much appreciate it. Now, you're joining me next week for the Understanding Cannabis as Medicine, right?
Absolutely. And thank you for having me.
We thank you very much for putting up with some of the linkage issues and video issues that we have out there. Welcome to nature. Anyway, thank you very much for joining us, and please join us next week to talk about cannabis as medicine.